Good morning to our respective lecturers. Today we would like to present about advantages of serological tests.
Our group member consists of Nua Adlan, Siti Khadija Atika, and Siti Nurzakia. What is serological testing? Serological tests are blood tests that look for antibodies in blood that occur specifically in conjunction with certain diseases. There are different types of serological tests, including flocculation tests, neutralization tests, hemagglutination inhibition tests, enzyme-linked immunosorbit assays, ELISA, and chemiluminescence immunoassays. What are the advantages of serological test? Firstly, quick and easy to perform. Next, less expensive than a molecular test, with a high sensitivity and low specificity. Then, serological test is epidemiological survey based on the study population. Lastly, it is a highly standardized technique.
For the disadvantages of serological testing, false positive reaction can occur through cross-reactive antibodies. Second, vary in specificity and sensitivity. Lastly, less sensitive than real-time PCR. Why do we need serological testing? Serologic testing are used to look for antibodies to specific diseases, including COVID-19, hepatitis, measles and mumps, and varicella zoster virus. Second, it can determine whether a person has been exposed to a particular microorganism. It can show that you have antibodies to a disease, but it can't show if the antibodies are from a current or past infection or from a vaccination. Next, it can detect autoantibodies, which is dangerous antibodies that assault body components that are linked to autoimmune illnesses like rheumatoid arthritis that may be a sign of an autoimmune disease. Autoimmune diseases cause immune system to attack our own cells, tissues, and/or organs by mistake. Here is how testing for antibodies work. Take blood sample and load it into an antibody test device. In this machine, the COVID-19 antibodies bind to the COVID antigen. Meanwhile, the other antibodies don't or weakly bind to COVID antigen because they are not trained to attack this specific virus like in this dishwasher. Then wash off all the unbound or weakly bound antibodies. If it detects them, the machine determines that antibodies are present. The test result may indicate that have a specific new antibody to the virus that caused COVID-19 disease. But unsure if COVID-19 antibodies detected mean that they can protect from infections. Also, something could be dealing with false negatives or maybe even worse, false positives. For example, antibodies to a similar virus like the common cold could cross-react to thesis viral antigen. When will the test be positive? According COVID-19 indicates that patient may have antibodies to the virus that caused COVID-19 from a prior infection or vaccination. Some antibodies developed against the virus that caused COVID-19 offer protection against infection. If patient already had COVID-19, getting vaccinated can help body develop more of these antibodies. Even if patient have never had COVID-19 symptoms, they may test positive for antibodies. It is possible for a patient to test positive for SARS-CoV-2 antibodies even if they do not have those antibodies. A false positive reported. For negatives test, it's possible that patient don't have COVID-19 antibodies. This could be due to a lack of exposure to the virus that causes COVID-19. It takes longer for some patient to develop antibodies, and a small percentage of those who are infected or vaccinated may never develop antibodies. When patient develop particular antibodies to SARS-CoV-2, they may test negative for SARS-CoV-2 antibodies. A false negative reported. Principle of serological test is the most common. Neutralizing antibody assay, complement fixation test, and immunoassays. For neutralizing antibodies that reduce the virus's infectious ability used to determine immunity, involves both IgG antibodies. They involves mixing known amounts of infectious virus with serum samples and incubating them for a short time. Today, plaque reduction assays are frequently used to perform neutralizing antibody assays, which have higher accuracy but more complicated technical requirements. Because they are not extensively used in regular diagnostic services. For complement fixation test, it is used to determine virus antibodies in patient sera or cerebrospinal fluid samples. The test mostly used to assess IgG antibodies and based on the complement's ability to bind to antigen antibody complexes. Complement promotes lysis of red blood cells when the complexes are present on their surfaces. For immunoassays, Antibodies binding to specific immobilized antigens can be directly observed in immunoassays using bound antigens and appropriate indicators like labeled anti-immunoglobulin antibodies. The most recent immunoassay formats allow for simultaneous detection of antigens and antibodies, significantly reducing the time between infection and immune response. There are numerous commercial kits available with good specificity and sensitivity. That's all from us and thank you.